It's Plush Tonight, showcasing the latest in professional spa treatments from Plush Medical Spa, Westgate Parkway, Dothan, with owner and medical director Dr. Amanda Bell, board certified in internal medicine. Here's Dr. Bell with your host, Barbara Cannady.
Hello everyone, and welcome back to Plush Tonight. Hi, I'm Babs Cannady, and we are here at Plush Medical Spa, located on Westgate Parkway in Dothan, Alabama. And here I am again with Dr. Amanda Bell. And what are we doing tonight?
Well, tonight we're going to be talking about what people call the liquid facelift. Have you heard of the liquid facelift?
No, what is that?
Well, it's also called the lunchtime lift and goes under several names, but essentially it's using injectables, liquid type products, to achieve what you want to in the face without having to go under the knife.
So it's quick and easy and...
Well, it's much quicker and much easier than surgery, that's for sure. But we use a combination of the botulinum toxins like Botox, Dysport, in combination with the filler products like Juvederm, Restylane, Radiesse, to make you beautiful. Essentially, you've had a liquid lift. It's just you didn't have it all done at the same time.
Oh, that was up in here?
Well, you've had filler in your cheeks and
yes.
in your lower face and your lips. You've had the botulinum toxins used in the upper face. So essentially...
You're telling everybody my secrets.
I know. We've accomplished everything in you, but we didn't do it all at the same time.
Okay.
Doing a liquid lift, we tend to use both products at the same time, and we can use a little here and a little there, or a lot here and a lot there, and so price will kind of differ accordingly, but yeah, it's pretty awesome.
Botulinum toxins, what is that? Botox?
Yeah, botulinum toxin type A is essentially the active ingredient in Botox. It's also the same toxin in Dysport, which you have had, and in the newly cosmetically approved Xeomin product. We have all three of those here at Plush, and we use them in the upper face to weaken the muscles so that you cannot fold the skin in those areas anymore. We use them in the area between the brows so that you can look mean, but you can't fold the skin there and make those vertical lines. We also use them in the forehead area, as you know, so that we can raise our brows slightly, but not enough to fold the skin up there and cause that permanent folding injury and end up with a permanent line there. So you don't have to look frozen. It doesn't have to look unnatural. We've both had it done ourselves, but it can look wonderful. I mean, as you know, we look airbrushed.
Does it hurt?
Yeah, it hurts a little bit. It's like the pinch of a little tiny needle. It's about 4 to 6 sticks in the forehead or the area between the brows, but it's over in about 30 seconds, and that's a very little bit to go through for 4 months of happiness.
Absolutely. Just a little pinch of pain will do you. It'll be good.
Yeah, essentially most people only have to do this about 3 times a year, although there's variability among patients, and so you're looking at anywhere from 2 to 4 times a year with the botulinum toxins to keep that up and to keep the area nice and smooth looking.
Really, the needles are so thin. I mean, she's really talking about very minimal pain at all. It's just like just a little, and that's it, and it's over.
Yeah, it's very quick.
What about the cost?
Well, it depends on the area, and it depends on how much muscle mass you have in that area. So if you're a big guy, you're going to need more toxin than a dainty little woman with smaller muscles in that area. But usually to do the area between the brows is between, $150 to $200 for a woman, and a little more than that for a man. And then the forehead would actually be a little less, because we try to undertreat the forehead to maintain height of the brows. So the less we use there, the better.
So when a patient comes in and does this, how long does it take for afterwards? I mean, can they go straight back to work? Can they do their daily activities, or what?
Well, it depends on how far you're going with it, Barbara, because if you're just doing a botulinum toxin injection, you can go right back to work. No one's ever going to know you've had anything done. All evidence disappears in about 15 minutes, and really the stuff doesn't start to kick in for a day or two. So, and it takes up to a week to get to the full result. But after a botulinum toxin treatment, you can go right back to work. But if you're doing something more involved, like a liquid facelift, you're probably getting filler as well. And after a filler procedure, as you know, you're probably going to want to go home. You feel like you've been through a lot more, because you have been through a lot more. Typically, when we do filler, we're replacing volume in the lower face. And to do that, we numb you up a little bit like the dentist does, with 4 shots in the gums, 2 up, 2 down, to get you good and numb in that area. Now, you're not going to stay numb as long as you would with that dentist numbing. We don't need it to last that long, but that is the most painful part of the procedure. It's over pretty quickly, you know, only about a minute to get that part over with, but we want you to be nice and comfortable for placing the filler. So getting you numb is the way to do that. So because you have to get numb, because there's, you know, more filling going on, more invasive type things happening to you, filler's a little bit more involved and rougher on you than a quick botulinum toxin treatment. So typically people are going to want to go home. You don't want to lay down after these treatments because...
I was going to say, what does a patient do after they have the procedure done? There's some things to maximize it and things like that?
Well, you do have to be careful with the filler that's put in the cheek area, but you don't really have to be all of that concerned about anything happening with your filler. The main thing afterwards is that you need to not lay down for at least 6 to 8 hours, preferably 8, and not do anything strenuous. No exercising, no heavy lifting. We don't want you to do anything that's going to raise the blood pressure in your head because that will worsen your swelling and potentially any bruising that you may have.
Is there anything that a patient needs to do beforehand when they come in, before the procedure?
Well, like I mentioned, bruising. If you want to try to minimize that, the best thing that you can do is avoid aspirin type products, those non-steroidal anti-inflammatory drugs like ibuprofen and naproxen. Of course, if you're on those drugs, especially aspirin for a specific reason, you want to stay on them. You don't need to come off of any of those drugs to get filler. It's just they make you a little bit more likely to bruise. Now, if you're a person that bruises easily, you'll probably bruise with filler, but if you're not, you may not. I tend to tell people to plan on bruising so that they don't have anything important coming up in the days following the filler, because you don't want to be covering up a bruise if you have a speech to give or wedding photos to shoot or something like that.
So Botox lasts a few months, so how long does filler last?
Well, it depends on the filler you use, but typically fillers last about a year. You're looking at touching them up about every year. The thinner fillers, Juvederm and Restylane, don't last quite as long as the thicker filler, the Radiesse. Juvederm and Restylane will last you up to a year, and we usually use those in the lips and in the fine lines around the lips because they are thinner gels. They can be used closer to the surface and in really soft places like the lips. Nobody wants their lips to be hard. The thicker filler is more like a soft putty, and that's the one that we use in the cheeks. That's the one you and I have in our cheeks. That's the one that we can use in other places in the body as well. It's a pretty neat filler. You can put it anywhere you want. One of the newer applications is putting it in the bridge of the nose to improve the contour of the nose in people that have irregularities along the bridge, and I think we have a patient here today that we're going to do that on. I'm Dr. Amanda Bell with Plush Medical Spa. I do Botox, Dysport, and dermal filler treatments, Thermage skin tightening procedures here at Plush. The spa also offers massage, facials, chemical peels, microdermabrasion, waxing, eyelash and eyebrow tinting, manicures and pedicures. We carry all Obagi medical skincare lines and Jane Iredale Cosmetics. Visit PlushMedSpa.com.
Plush Med Spa, the medical spa with more.
Hi Lisa, I'm Dr. Bell.
Hello, nice to meet you.
Nice to meet you. We have you down for filler and botulinum toxin today, is that correct?
Yes.
Good. Well, where were you thinking about getting filler placed?
In the nose and right along here.
Okay, and the botulinum toxin, I assume you want to get rid of the lines here. Most people do, right? Put your brows together for me, all right? And raise your brows up for me. Are you wanting to get rid of those lines as well?
Yes.
All right, well, I think that'll be a good choice. The botulinum toxin type A that we'll use on you today is Dysport, and it's my favorite. And we carry 3 of them right now, but I tend to have a preference toward the Dysport. It works a little bit quicker than Botox, and for some people it lasts longer too, so it's hard to beat that.
Okay.
All right.
Good.
Well, if you're ready to get started, the first thing we want to do is numb you up. We'll do that numbing sticks inside the mouth, and we'll get that out of the way right off the bat. Now, I know you signed your consent forms. Do you have any questions for me?
And then I'm ready to get started. I'm a little nervous.
Well, that's okay. It's typical. But, you know, you've never been through this before, so you don't know what to expect. After you've been through it the first time, maybe the next time won't be so difficult mentally. All right?
Okay.
We're just going to numb you up.
Okay.
So just loosen your lips. And you're going to feel like I'm pushing this slowly, but it's because it actually hurts a little bit less when I push it slowly. So there's a reason. Sorry, I know it's uncomfortable. All right, it's all in there. So we'll go ahead and do your Dysport injections in the forehead and the area between the brows while you're getting numb down here. Sound good?
Okay.
Okay. First thing, I'm going to clean you up with a little alcohol here,
Okay.
just to get the area clean that we're going to inject. You have very small muscles, very dainty, so you don't need a whole lot of toxin to achieve what we want to achieve in you, but we will have to see you back after a week to make sure it's perfect, because if there's any difference in diffusion of the drug, we'll want to add a little bit here or there to make it absolutely perfect. And I do touch-ups for free, so you definitely want to keep your follow-up appointment.
That's really great.
All right, so raise your brows and lower them, and raise your brows and lower them. Yeah, muscle tone all the way up to the hairline. All right, here comes your first injection. Just a little poke. The little crunch sound you hear there is your collagen layer as the needle passes through it. Makes a little crunching noise. Raise your brows and lower them. Hold them neutral. Raise your brows and lower them. Hold them neutral. Good. Forehead's done.
That was it?
Mm-hmm.
Wow.
It's easy, huh?
That was not bad at all.
I know. So much easier than everyone thinks it's going to be. Sounds so scary. Put your brows.
Does, but it wasn't.
Put your brows together for me, as mean as you can, and let them go.
Okay.
All right. Here's your injections here. Now these hurt a little bit more. The area closer to your nose is, a little more sensitive. Doing okay?
Mm-hmm.
Good. There you go. That part is all finished.
Oh, wow.
So now we're going to clean up the cheek area and the bridge of the nose. And we're going to do our injections. You want to turn your head sideways so everyone can see your profile. We're going to put a little bit of filler in this area on the bridge of the nose, just to kind of smooth out the line of the bridge of the nose and make it a little less dipped right here. And we're also going to add in some filler into the cheek area. You can straight on.
Yeah.
And replace a little bit of the volume you've lost in the mid-face. It's very good for shadowing in this area, which you don't have very much of. And then we can put some filler down in this area too, in the lower face. All right, Lisa, well the first filler we're going to do is up here in the nose area. So you just want to keep your eyes closed. Your brain will probably feel better about it if it's not watching.
Okay.
You're going to feel the poke of the needle. It'll be a little uncomfortable until the lidocaine starts to numb it up a bit. And just put a small amount in and let the numbing take effect. Doing okay?
Doing fine.
Feels weird, huh?
I really didn't feel that hardly at all.
Yeah, good. The numbing takes effect pretty quickly.
It does.
Okay, third poke. Little goes a long way with this filler. And it's always best to underfill a little bit and go back and add a little more after a few months. It layers in nicely. This filler is Radiesse, and it's different than the Juvederm or Restylane. It's made out of calcium, and it lasts longer and is much more moldable.
How long does this last?
Well, it kind of depends on you and how quickly you metabolize it, but it should last about twice as long as the Juvederm or Restylane, up to 2 years.
Oh, wow.
Usually people need it touched up after about a year, though. All right, a little more here. Should be pretty numb now.
I'm not really feeling a thing.
Good. 'Cause it's looking really, really good. All right, another little poke. You didn't feel that one, did you?
I didn't feel a thing.
That's good. So to put the filler in the cheek area, I'm going to put my finger kind of right on the lower ridge of your eye.
Okay.
All right? And that just serves as a little guide for me. You're going to feel a little poke. Or maybe you won't feel too much because you have, you know, the numbing material in your cheek a little bit. Doing okay?
Doing fine. Didn't feel a thing, really.
Good. You got a little blob of filler in there now.
I could hear it. I just didn't feel it.
Sometimes it can make a little bubbly type sound as it goes in. Your next injection. One more. Now I'm just going to mold on it a little bit, kind of meld these little boluses of filler together all along that bone. The nice thing about this filler is how moldable it is. You can really do anything with it. Same thing on this cheek. Finger here. You feeling pretty numb down here in this area?
Very numb.
Good. Well, you'll probably feel the little poke of me going down here a little lower, but you shouldn't feel anything else. So
Okay.
you just let me know. If you need more numbing, we can add it. I'm just going to put a tiny bit of this thicker filler in there to those deeper lines. And then we're going to go, then we'll go back with the thinner filler and go over this area as well. Just got a couple of thick ones. All right. All right, so we're going to start with thinner filler, and that's going to go into your lips in the area immediately around your lips.
Okay.
So I want you to part your lips slightly, and you may feel the initial poke, but other than that, you really shouldn't feel much. Should be pretty numb. Doing okay?
Doing fine.
Okay. Now you have, you know, average size lips. They're not incredibly small, but I wouldn't want to overfill them. You know, we can make lips bigger and we can change the shape a bit, but not markedly so. We just want to put back what you've lost over time. Doing okay?
Mm-hmm.
Good. You will have some swelling today, and as long as you don't lay down for at least 6 hours, the swelling should be much improved, if not gone, by tomorrow. Shouldn't exercise today either. Just take it easy, but don't take it so easy that you lay down. Your lips are looking awesome. Woohoo! We're going to do a little bit of filling in this area right around the mouth.
Okay.
You know, the nasolabial folds and the marionette lines are a very common area to fill, but you don't want to overfill this area right at the side of the mouth or you'll end up feeling a little chipmunky and not like yourself, okay? So, you know, you can see when you smile, at least the audience can see when you smile, that you have muscles are pulling on tendons in this area. So if we try too hard to fill it in, the muscles are always going to pull on it and sort of squeeze the filler out of that area. So less is always more. Just relax your face. Just kind of diffusely add in volume in this area. Go back over the nasolabial fold one last time. Just massage it in. We'll also put a little bit down in this crevice here. Very good. You're doing great so far, swelling-wise, and I don't see any evidence of any big bruises forming, so you may get off relatively unscathed. All right, so treat it really kindly. You can mash on it, but don't really mess with it for the first day because I don't want you mashing around on swelling rather than filler. So I want to see you back in a week so that we can look at your forehead and make sure it's all even. Check out this area, see how this is going. I can move around, mold around on your cheeks a little bit if need be. And we'll just reevaluate everything at that time. I think you're going to be really surprised. Nose-wise, there's really no maintenance for you to have to do on your own. There's going to be a little bit of swelling in this area, but this filler is fairly moldable, so don't go, you know, mashing a whole lot on it. And if you want me to mash and mold on it, that's fine. We can do that at our follow-up appointment and at any point thereafter. All right, take it easy today.
I will.
No laying down. Hi, Lisa.
Hello.
How's it been?
Going well.
Okay, so we're a week out exactly from your filler and your botulinum toxin treatment. How'd you do? Did you have a lot of bruising?
Just a little bit on the lip, but after 2 days it went away.
Well, that's lucky. Most people who bruise have to deal with it for at least a week or so. Must not have been a giant one anyway. Your lips look really good to me, nice and even. You know, we also put filler in your cheeks and those look really, really nice. That whole under eye area looks improved to me. Let me have you make some facial expressions and we can see how good your botulinum toxin is done. Look angry and put your brows together for me. As hard as you can. Now let it go and now do it as hard as you can. Excellent. We're not folding anything there. That's excellent. All right, raise your brows. Okay, you've got good movement left in your brows still. Raise them again. Okay, and let them down and raise them one more time as hard as you can. Okay, you've got a lot of movement up here and that's good. You want to be able to express. There are tiny little lines being formed with that movement right above your brow, and we could probably add a tiny little bit to improve it, but I kind of like your brows with some movement in them and that lift, and certainly, you know, the majority of the brow is just so smooth and nice. It looks really, really good. Very, very smooth and nice. You look lovely. Okay, so lip-wise, you still have a little bit of the remainder of that bruise left. There's a little bit of discoloration there, and you know, bruises are volume too, so that will affect that slightly. Up there, it looks good too. You have more upper lip than you've ever had in your life, but it's not freakish by any means, so you probably like it.
Most people can't tell.
Do you like it?
I do. I like it a lot.
What's your favorite part out of everything we did?
The lip.
Really?
Because my top lip has always been so skinny.
You know, we added some volume into your nose as well. Let me have you turn your head this way a little bit. And we put volume in this area. We don't want to add so much that we bulk out this low area in the brow between the eyes. So it's best to layer it in and not completely bulk it out there. I would think maybe in about 3 to 6 months, layering in a tiny small amount after that Radiesse has been locked into your body. Do be careful about wearing sunglasses on the bridge of your nose.
Okay.
Pick the kind that have the pads on the side of the nose, so you're not putting pressure right on that soft filler, especially during the first month or two while it's still pretty soft. Same goes for the cheeks, you know, no sleeping on your face.
Right.
And try to treat them kindly. You'll want to roll up with some pressure on the underneath side of that filler in the evening time, just to keep it high up on that, on the cheek ridge. And that'll help make it last a whole lot longer and keep it in the spot you want to keep it in until your body locks it in. So, all right, well, you look fantastic to me.
Well, thank you. I like it.
Well, let me know if you ever need anything else.
I will.
Hey, look at these before and after pictures of Lisa. That is amazing.
Yeah, isn't it incredible what a little bit of filler strategically placed can do? And the lines are all smoothed out. She looks airbrushed. That's the best word for it.
And it's a subtle thing. It's not something drastic. You know, it's something that people will look at her and say, wow, you look really good, refreshed. There's just something about you. I can't picture it, but it's really great that people can do that.
Yeah, I think what you're saying is she's not overdone. And that's what everybody wants. Nobody wants to be overdone and look weird or not like themselves. They just want to look like a better version of themselves, subtly so.
We would like to thank Lisa for participating tonight, and she looks great. And thank you, Dr. Bell, for educating us on all this.
My pleasure. We want to remind everybody that you can visit us online at PlushMedSpa.com and see video of all of us and some of our procedures and see all of the services we offer, and you can even buy gift certificates online there.
So, tune in to another episode of Plush Tonight.
Bye.
This has been Plush Tonight with Dr. Amanda Bell. Thanks for watching.